see the puppies? You did? You want to go around with Mommy? You did? What are you doing? I'm going to get you. I'm going to get you. You want to get in your stroller?
Yeah.
Come on.
Tell me, when you were diagnosed, how long you've lived with scoliosis,
Okay.
and then kind of when it was at its worst, how it affected you.
Okay. When I was in elementary school, my dad actually noticed it. He was rubbing my back and felt, it's kind of like my spine disappeared, which it didn't, but, and so we took me to the doctor and found out I had scoliosis, and I started out, and that was in around 4th grade, and I started out wearing what they called a Scolotron at that time, and it's kind of like when you get a sports injury and they put those little machines on you that shock or whatever, and I wore that for about a year. That didn't work, so then they put me in a back brace, and I wore a back brace from 5th grade, or about 6th grade, all the way till I was a junior in high school. And that seemed to work. I mean, it kept it at the same degrees for years. And then once I got out of the brace a few years later, that's when it started getting worse. And, I stayed with the pain for a while, probably 5 or 6 years before I went back and saw Dr. Geck. And then I was like, yeah, something, my back's bothering me. I can't sit in a recliner. If I sat in a recliner for more than, a minute, it would just start killing me. And then saw him, and it had gotten progressively worse than what it was, the last time I had been to the doctor. So
what was the degree of your curvature? Like when you saw Dr. Geck at its worst, what was it?
It was around 51, 52, somewhere around there, I believe.
And so you said just sitting in the recliner was really painful. Did it also limit you with other things?
I could still do things. It just, it was a little bit more painful. But, I could still exercise and work out. It just, the pain just started getting worse every, daily. It just kept progressing over the days and weeks. And finally my husband was like, we're not doing this. So he did his research on the internet, and that's how we pretty much found Dr. Geck.
So once you got to Dr. Geck, what did he? Well, first of all, what was your, your first impression of Dr. Geck and his office staff once you got here?
Oh, we were very impressed. Really liked him. Dr. Geck took the time to answer all the questions that we had, and my husband was with me, and he is, he's gonna grill you a little bit to make sure we're at the right doctor, and he's very protective, and so we were really happy, really impressed with everybody.
So then, what did Dr. Geck tell you in terms of treatment?
He said, the best thing, looking at it and to see where it had progressed from previously when I was younger to now, that really surgery was the best option. I don't know.
Well, no, and that's okay. What did he say that when he did the surgery, what that entailed and what you could expect from him?
He said, the surgery, I would be in the hospital for a few days, and I would be back to being able to do everything that I was used to doing within about a year's time. So I would be out, about 4 weeks to 6 weeks, I would be out of work or, doing my normal everyday routine. And 4 weeks to the dot, I started back to work my last day of the 4th week, so that was good. And everything he said was right, and I stuck to that, and I was back to work and ready to go.
How long ago was your surgery?
Let's see. So it was about 5 years ago.
Oh, was it? Okay. So
Yeah.
You were 23 when you had
I
it?
believe I was 23.
So you said about 4 weeks after the surgery you're back to work. What else? Then how gradual was it before you could do the physical activity and then kind of bring
After that 4 weeks, I started walking, I'd go to the mall, walk around there, started kind of slow and gradually. Within a couple of months after that, I was walking up to a mile. And then 6 months, I think I started jogging a little bit, but mainly just walking. And then after a year, I was back to running like I'm used to doing, and doing full-blown boot camps. So, which consisted of carrying logs, pulling tires, push-ups, sit-ups, carrying people, swimming in Barton Creek, and all that kind of stuff. So.
I mean, Did you ever think, looking back when you were in all this pain before your procedure, did you ever think that you would be at a point where you could do this boot camp and doing those real...
No, especially after the surgery, because you're real, you're kind of stiff right after the surgery, and you're like, there's no way I'm ever going to be back to, doing the things that I was doing. And now you don't even, you don't even recognize it. You just go on. Nobody even knows you've had the surgery. So it's pretty good.
So for other folks out there who may be in your same situation, who are, a lot of people are scared to have surgery, and especially an invasive one like the one that you had.
Right.
It's a big deal staying in the hospital. What would you tell them?
It's honestly the best thing I've ever done, and we, having it young and going to a different doctor when I was young, that particular doctor was trying to keep me from having surgery. I mean, I guess you don't ever have to want to have surgery unless you have to, but so my parents were real skeptical of, no, we don't want to do the surgery, and then once I did it, I'm like, I wish I would have done it back, 10 years before I had it, because it hasn't limited me. I've been able to do everything, and I don't have no back pain now. So, surgery is always going to be a little bit scary, but it's worth it in the long run.
Because also, was part of it, were you telling me, and I'm trying to remember, I know I talked to a few different patients, I know you've had a baby obviously since your surgery. Was that one of the concerns, that you weren't sure how painful it would have been to carry a child?
Yeah, that was one of the concerns that my husband and I had. We're like, look, you're still young enough, because obviously when you get older, surgery is a little bit more hard on your body, and we weren't ready to have kids at that point, and I was afraid, if I did get pregnant, that I would be in so much pain during the pregnancy that, it'd just be miserable. So before we decided to have kids, we're like, let's go ahead and do the surgery, get things done, and then it'll be done when you have kids, and, hopefully you won't have back pain then, and I didn't. My pregnancy was great. I didn't have any back pain, so probably had less back pain than most people that have never had surgery, so.
And then just the final question, and you touched on it before about, the experience with Dr. Geck's office and their office staff. Did they explain everything to you? Did you feel at ease?
Yeah, they worked with you. Dr. Geck explained everything. When I would do my x-rays, they were real, told you exactly what they were going to do, lined you up, didn't surprise you with anything. You always knew exactly what you were going to do and when you're going to be it. And also they helped out with the insurance. You never know what your insurance is going to do, and so they explained, this is what's going to happen, and they handled all of that, and that was real nice, and I really didn't have to do anything. They just pretty much took care of everything for me, so.
That's your knees, I'm sure.
Yeah.
So can you just show me again?
Sure. This side of my back used to stick out several inches further than this side, so if I was just standing straight, you could see the difference of, how the back stuck out further, and my shoulders were unlevel as well.
I think it's important to include, just to kind of educate other people who may be in your same situation.
Just do your research and ask people, get referrals from Dr. Geck of who's had the surgery before, and call them and get their opinion of it, because honestly, it's the best thing I've ever, I haven't had any problems. You hear people have back pain all the time, and I'm like, I'm free of back pain. So, just talk to people, talk to previous patients and see what they went through.